Hello and welcome back to Urology Consultation Channel. In today's video, we're diving into the topic of high-pressure chronic retention, or HPCR. It's a condition that's not often discussed, but is crucial to understand, especially for those who may be experiencing lower urinary tract symptoms. By the end of this video, you'll have a clear grasp of what HPCR is, its causes, symptoms, complications, and treatment options. Let's get started. High-pressure chronic retention, or HPCR, refers to a condition where the bladder is unable to fully empty over a prolonged period, resulting in high pressure within the bladder and a significant increase in the bladder capacity. This pressure can back up into the kidneys, potentially leading to swelling and kidney damage. Unlike acute retention, which happens suddenly, HPCR develops gradually and may go unnoticed for a long time, and the bladder can hold huge volume of urine up to 2 liters. There are several underlying conditions that can lead to this issue. One of the most common causes is an enlarged prostate, also known as benign prostatic hyperplasia, or BPH, which obstructs the flow of urine. Other causes include urethral stricture, which is narrowing in the water pipe, bladder neck obstruction. The bladder neck is where the prostate joins the bladder, and the angle can be acute in some people, causing blockage to the flow of urine. Other causes for HPCR include neurological conditions like multiple sclerosis or spinal cord injury. These conditions interfere with the normal function of the bladder and urinary system, leading to retention. Now let's talk about the symptoms. HPCR often presents with lower urinary tract symptoms, such as difficulty starting urination, a weak urine stream, and the sensation of incomplete bladder emptying. Over time, patients may also experience frequent urinary tract infections, incontinence, or even visible swelling in the lower abdomen. Bedwetting is one of the most distinct symptoms of HPCR. The reason for bedwetting is that overnight the external sphincter muscle relaxes and the pressure in the chronically full bladder results in overflowing of urine. This is also called overflow incontinence. However, it's important to recognize that many cases of HPCR are completely silent, and they come to light after doing a blood test, which shows that the kidney function is very impaired, or after having a scan, which shows that the kidneys are very swollen, and the bladder is massively enlarged. If left untreated, HPCR can lead to serious complications. The high pressure in the bladder can travel up to the kidneys, causing hydronephrosis, which is the swelling of the kidneys due to urine buildup. This can result in kidney damage and, in severe cases, kidney failure. That's why early diagnosis and management are so critical. Diagnosing HPCR involves a thorough medical history and physical examination. Doctors often use ultrasound to check for residual urine in the bladder after voiding, and also check the health of the kidney and the presence of any swelling. Blood tests may be done to check kidney function. These tests help determine the severity of retention and guide the treatment plan. When it comes to treatment, immediate catheterization is often necessary to drain the bladder and reduce the pressure on the kidneys. Following catheterization, the patients are monitored in a hospital environment overnight. This is to prevent the potential serious consequences of a condition called post-obstructive diuresis. In this condition, the kidneys go into an overdrive, and the patient produces up to 5 liters of urine in few hours. This can be serious and can result in a drop in the blood pressure and even a collapse in the worst-case scenario. Occasionally, the blood tests could become abnormal, especially the salt levels, and these might need correcting. Patients might require intravenous fluid replacement, hence the need for hospital stay in the first 24 hours after catheterization at least. Surgical interventions such as transurethral resection of the prostate, TURP, or bladder outlet procedures is often necessary. It is not recommended to remove the catheter after an episode of HPCR, because the same problem will reoccur again. As a compromise, and in patients who are not keen on surgery, intermittent self-catheterization could be taught by specialist nurses. In this technique, the patient passes a disposable catheter in and out of the bladder at least 3 times a day and once at night to ensure that the bladder pressure is kept at a reasonable level by emptying it frequently and that no pressure travels up the kidneys. However, this management strategy is not ideal and should not be encouraged, as the bladder pressure could rise in between catheterization episodes and can result in potential kidney damage. Prevention is always better than cure. Regular checkups, especially for men over 50, can help detect conditions like BPH early. Most importantly, don't ignore symptoms like difficulty urinating or frequent infections. Early intervention can make all the difference. And that's a wrap on today's topic. High-pressure chronic retention is a condition that's often overlooked, but can have serious consequences if untreated. Please bear in mind that this video does not cover acute retention of urine, which is often painful and with less amount of urine in the bladder and no pressure on the kidneys. We will devote another video soon to talk about acute urinary retention. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and subscribe to Urology Consultation for more health-related content. Thanks for watching and see you in the next video.